5, 4, 3, 2, 1. Let's go. Diary of a Kidney Warrior podcast in partnership with Kidney Care UK, sharing faith, knowledge, hope, and love.
Hi, and welcome to Diary of a Kidney Warrior podcast. My name is Dee Moore, and I am a kidney warrior. This podcast is dedicated to encourage, educate, and inspire as we explore all aspects of kidney disease, related chronic illnesses, and health. If you have any questions or ideas for topics you would like me to cover, please get in contact with me on social media using the handle Diary of a Kidney Warrior. My guest today from Birmingham, England is dialysis nurse Alain Tria. Alain joins me today to share tips and advice for hemodialysis. Hi, and welcome to Diary of a Kidney Warrior podcast. How are you doing today, Alain?
Hi, Dee. I'm doing well. And you? You're all right?
I'm good. I'm really excited about today's podcast because today we're going to do something a little bit different than what we normally do with health professional interviews. Because I'm the type of person that kind of likes to get to the point very quickly. But sometimes I think actually we're losing a bit of information about the person behind the interview. So we're actually going to do a bit of a spotlight on you, Alain, as well as covering the topic of today. And today's topic is tips and advice for hemodialysis, a nurse's perspective. I really like that title. I really do. And I'm really excited to be discussing this with you, but also getting to know you, Alain.
Yes, it's a pleasure to be here, Dee.
So before we get into the spotlight on you, because we're going to be talking about hemodialysis today, I always like to start with a definition just to make it clear for anyone listening, because we're going to be talking about hemodialysis. People might be thinking, what is hemodialysis? So I think we're going to start with the definition and then the spotlight on yourself and then the tips and advice. So my first question is, what is hemodialysis?
So for me, the simplest description of hemodialysis is it's the process of removing or filtering out the waste or the toxins from the blood using an external machine called dialysis machine. So that's the simplest explanation. If I may expound on that, what happened is when a patient comes in to the clinic and they have their dialysis session, so they will be sit in a chair and then they will be connected on the machine through their vascular access. That it could be a fistula, a graft, or a central venous catheter. And then we connect them through the vascular access to the machine, and then their blood goes through the machine through the dialyzer, which acts as a kidney, this dialyzer. It's the filter. It takes away the waste or the toxins from the blood. And then there's another tube that will return this clean blood going back to the patient. So that's what really happens inside the dialysis clinic. Hopefully, this will make it easier for the listener to see what's really going on inside the dialysis clinic.
Yeah, I think that generally when people think of dialysis, they think of hemodialysis and they picture somebody sat next to a machine and everything whirling round. And in simple layman's terms, hemodialysis, when I think of it, it's to take your blood out, clean it, and put it back in. I mean, would you agree that that's like the simplest way of explaining
the simplest analogy. Yes, I agree. Yeah.
And there were a couple of terms there that Alain used that for anyone who wants more detail about it was covered in episode 72, Innovation in Fistula Options for Dialysis Patients, where we go in depth about the different fistula options, also what a graft is, etc., etc. So for anybody that wants information about the different vascular access, check out episode 72 of Diary of a Kidney Warrior podcast. Right. So now that we've explained the basics of what hemodialysis is, and we appreciate it is way more complicated than that, but we're just kind of breaking it down as simply as possible. I want to go into a little bit of a spotlight on yourself, Alain, to get to know you, and then we'll go into the advice and tips. So My first spotlight question, this is the first spotlight question I've ever asked. So this is a first on Diary of a Kidney Warrior podcast. Here we go. How did you become a dialysis nurse and why?
Just to give a quick backstory, the first ever time that I was exposed with kidney disease was when I was a student nurse. And because for 1 month, I was assigned in a renal ward. So that was the first ever I was seeing renal patient, for the first time. I was still a student. And then moving a bit fast forward, when I became a nurse, a registered nurse, I was working as an occupational health for almost 5 years. And then during that time, I was doing several external training, just to gain more knowledge. And one of the trainings that I did was hemodialysis. And so for 1 month, I was in a dialysis clinic. And at the time, all I saw was fistula patient, patient with a fistula. And also that was the first time I've seen hemodialysis machine in my life. Fast forward, the current times, here in the UK, when I got my pin to this as a nurse, I was looking for job opportunities. And one of the job ad that I saw was looking for a dialysis nurse. So I was thinking, oh, I think I could do this. So I applied, and luckily the company responded to my application the following day. And I did the interview. Everything went so smoothly. And then that's it really, and then I become a dialysis nurse. And I can remember during my first few weeks, it's a bit overwhelming to see this machine. And I was afraid of committing mistake, what to press and how to do this and that. But I had a good mentor to train me for 12 weeks. Now it's over 2 years now that I've been doing this. So I'm very confident now with what I'm doing.
So in many ways, hemodialysis, being a dialysis nurse came to you, really. It was like, it started with the placement that you had. So the seed was planted there and then the advert popped up and you were like, yeah, I'm going to go for it.
Yeah, that's really it, really. So looking back, it could be destiny, perhaps. You could say that.
Yeah, absolutely. Sounds like
Because, yes. Yeah, now I enjoy being a dialysis nurse. It's really fulfilling job. Yeah.
So what do you like most about your job?
Oh, that's a great question. I would say two things. It's not just one. I would say the thing that I like the most, first of all, is it's an outpatient setting. So what does it mean? Patient just come and go. Because as a nurse, I didn't really see myself working in a ward. So I like this kind of setting. And the second one is somewhat related to my first answer, because patients come to the clinic 3 times a week. You get to know them better because you see them 3 times a week. So you build this special bond, this nurse-patient bond, which also develops into trust. Because this kind of work is a bit routinary, but things becomes easier when the patient trusts you, when you're doing the treatment on them. So this is the two things that really I like the most, about being a dialysis nurse. So it's like you're seeing a friend or somewhat family. So it's not like, oh, I'm going to work, but it feels like, oh, I will see this, I will see her. So these two things really what makes it pleasurable to work as a dialysis nurse.
It really is wonderful to hear how passionate you are about your job, and just seeing that smile on your face when you're talking about your job. I genuinely love when I see health professionals that are passionate about what they do. Shout out to all the passionate health professionals out there that are listening to the podcast. We salute you. So let's move on now to the tips and advice part of the interview, because in the time that you've been a dialysis nurse, you've met so many different patients, you've worked with different health professionals and nurses and your mentor. So I'm sure there's loads of tips and advice that you have that can help not only people who are listening to this who are about to start hemodialysis, but also people that have been a hemodialysis patient for some time, and maybe there's something that you could say to them that they're like, oh, I didn't know that. That would be really, really helpful. I do have to start with a disclaimer. that we're not giving medical advice during this interview. Consult your consultant, your medical team for specific medical advice. What we're giving here is for educational purposes only. So yeah, I'm going to hand over to you with the first tip. So what is your first tip or piece of advice for either someone who's just started hemodialysis or is on hemodialysis that will help them navigate this journey?
Okay. So I think I will start with an advice first before I tackle the practical tip. So my first advice will be for the patient to be an active part of the treatment team, because if you're a newly patient diagnosed with kidney problems, I highly encourage you to ask questions. What's the cause of the problem? What can be done? What treatment is available? Because by being active part of the treatment plan, your anxiety, fear will disappear because you know what's going to happen. And then secondly, this is very important to dialysis patient, is with their fluid restriction. My advice is really follow the prescribed fluid restriction by the nephrologist or the renal dietitian.
So for somebody listening who's new to all of this, I'll always try and explain jargon as it pops up, just for anyone listening who doesn't understand. So you mentioned the term fluid restriction. So for anyone who doesn't know what a fluid restriction is, what is a fluid restriction?
So fluid restriction, by the term restriction, basically you limit the amount of fluid you intake per day. In most patients that I've seen, it's 1 liter a day. Because as you know, because your kidney is not anymore functioning as it used to be, and you're drinking lots of fluid, so it tends to accumulate inside your body, because you're not peeing anymore. So this fluid is accumulating inside your body. So that's why the doctor will always tell you, that restrict it to 1 liter, for example, a day.
Yes, I'm very familiar with that because I have my own fluid restriction. So yeah, it is important. I can vouch 1,000% to stick to your fluid restriction because yes, what is the consequence if you don't stick to your fluid restriction? What will happen?
If you get overloaded with fluid, then you will have shortness of breath.
Yeah.
So you will feel really generally unwell. So it could be life-threatening if you're not disciplined enough to follow the restriction.
Right. So we are having a light-hearted discussion, but at the end of the day, there are serious implications of not following the fluid restriction. So yes, be an active part of your care, and yes, fluid restrictions, make sure you stick to it.
Yeah. So the third one will be somewhat related to the fluid restriction. It will be the following the diet that your renal dietitian has prescribed you, because other than the fluid restriction, the other important bit is your potassium level that we always check. So, because if you're not within the normal range, too low or too high is also has a serious effect or implication to your health. So following the renal diet is also very important.
And for anyone looking for recipes or tips about what is safe to eat as a kidney patient, Kidney Care UK's Kidney Kitchen has lots of recipes and recommendations by renal dietitians. So do check it out.
So my fourth advice will be to stay active, because even if you're a dialysis patient, you can still do some exercise. Of course, there's a limit what you could do. So you could always ask your doctor if you're not aware of what exercise you could do, but you can still do exercise. So staying active will also promote well-being, and also doing exercise also helps your mental health.
And there's also the benefit of helping with blood pressure as well by doing exercise. Am I right in saying that?
Yes. So yeah, it will also help with your cardiovascular health. Then my fifth advice will be make the most of your dialysis time. So what do I mean by that? Because normally, or most patients do 4 hour session each time, because 4 hours is really a long time, which I can totally understand. We have some patients who are still working, actively working. So what they do, they bring their laptop and they do their reports while having dialysis. we also have a very young patient who's still in university. So she brings in her assignment and she does it while having dialysis. So, that's one of few example of making most of your time while having the dialysis session. I can remember, this student, one of her assignment was to interview some healthcare professional. And so she was able to do that easily, asking nurses, you know. So you could also read a book, you could listen to radio or watch telly because each chair has their own telly. So yeah.
You can also listen to Diary of a Kidney Warrior podcast while you're having dialysis. That's also a good way.
Oh, yes. Obviously, yeah, that's really good. Yeah. That's coming from me, an avid fan of your podcast.
Oh, thank you. Thank
Yeah.
you.
Okay. And then my sixth advice will be don't let the dialysis rule your life. So what do I mean of this is because I know it can be a bit limiting, you feel entrapped because you have to come to the dialysis center 3 times a week for 4 hours each time. So I know it's a lot to take in, but you can still go on holiday. I can remember one patient, I told him, you haven't been on holiday for many years. Don't let it stop you from going on holiday because there is this holiday dialysis that we call. Of course, the only thing is you just have to plan in advance. If you want to go on holiday, just plan it in advance and you can still do these things. And visiting new places that you've never been before will also help your well-being and also your mental health. So you don't feel like you're entrapped. You cannot do this, you cannot do that, but you can still have like a normal life. Okay, with limitation though. Yeah, I can understand that. But don't let it rule your life. There's life around dialysis. That's what I want to say.
I think it's really powerful what you said about not allowing dialysis to ruin your life, because whether it's somebody who's just been diagnosed and they've just found out that they have to go into dialysis, or whether it's someone who's been on dialysis for many, many years, sometimes you can not see the wood for the trees. And to go on holiday and have time out, time away is so important. I mean, I recently went away for a few days and I had such a good time. It really was an opportunity to recharge my batteries and come back feeling so, so good. And it is possible as a hemodialysis patient or a peritoneal dialysis patient to go on holiday, whether it's the UK or abroad. And for more information about that, check out episode 63, Holidays and Dialysis, the freedom to travel. So it is actually possible for anyone that doesn't realize it is actually possible. So yeah, a really, really powerful statement that was.
Yeah, because breaking the cycle, because some people, they see it, oh, it's an endless cycle that I have to go to the clinic today. So I can also feel that it's like psychologically burdened, not just physically, but they need also to relax and refresh themselves and give a clean slate again that, okay, I've been out, I've been traveling, then now so at least it's like a new restart from time to time.
I totally agree. 100%.
All right. So now I'll go for my practical tips for dialysis patient.
Okay. I'm looking forward to this.
My first practical tip will be for those patients who comes to dialysis, not to wear very tight clothes. If you're wearing long sleeve, make sure it easily can be rolled up so that the nurse can easily access your fistula or graft. Or if it is a central venous catheter, make sure that your shirt top can easily be unbuttoned or unzipped so that the nurse can easily access your line. So yeah, I mean, because some people, they tend to forget wearing lots of clothes or very tight. So it's a bit challenge, to access their site.
That's a really, really good practical tip because for me, myself, I have a line, as everyone knows. So I tend to wear a vest when I'm going to dialysis. But also, if you've seen the reel on my social media, I have a top that has poppers on it so they can actually pop open the sleeves to access my arms and things like that. Yeah. So yeah, it's a very good practical tip. Loose clothing, definitely.
Yeah, loose clothing. Then my second one will be, this most especially for patient with fistula or graft, that be mindful that don't carry any heavy bags on your arm with the fistula. Make sure you use the other arm because it's not good for your fistula, your access to be carrying that weight. And also when you're at home and sleeping, don't lie on that side. And my third tip would be during hot weather temperature. Instead of taking more fluids, you can chew on ice chips. So it will help with your thirstiness. So without drinking too much fluid. So that's my third practical tip. And then my fourth practical tip, perhaps, I'm not sure if this, how practical this will be, but it's very useful, is if you can keep a weighing scale at home, because some people might, with relation again to the fluid restriction, maybe they do the restriction by having a measuring glass so that they know how much they are drinking. But one ideal thing to do as well is to maintain a record of your weight, because when it comes to dialysis, every patient knows their dry weight. And what is dry weight? This is your weight without the excess fluid. So if you know your dry weight and then you got a weighing scale at home, then you can also monitor your weight. You could say, oh, I might have drink too much water. And also those things that you cannot measure easily, like if you like eating food with lots of sauces, or if you like fruit and vegetable, because these things also contain water.
That's a really important one because you don't realize that when you're eating these things, they contain water. If you think of fruits that have a high water content and you're eating that, that can easily be not included in your mind when you're thinking of your fluid restriction. So yeah, watch out for, I mean, they're beautiful to eat and kidney friendly, but be aware of the water content. Things like watermelon, things like that can add to your fluid restriction.
Yeah, because without realizing it, it all adds up,
Definitely. Can I bolt onto that? Because you mentioned about a scale, and I think it's important to say also that bearing in mind what you're wearing when you're weighing yourself, because when I first started hemodialysis, I was wearing quite heavy. I didn't realize how heavy the clothes were. And that is going to be factored in when they weigh you and they're looking at your dry weight and your restrictions and all the rest of it. If you're wearing super heavy clothes, it's giving the wrong impression of what your weight actually is. So think about lightweight clothes and then wear the same clothes. I have a uniform that I wear to dialysis. So consistently wearing the same clothes means that I've got consistency in terms of when I weigh myself. And bear that in mind when you weigh yourself at home. If you're weighing yourself naked compared to weighing yourself when you've got clothes on. And also bearing in mind that some scales do tell you the water content of your body and some scales have a fat measuring thing. So it's a good way of seeing what the difference is, which will help maintain your dry weight. So that's my practical tip. I hope that makes sense. That's my practical tip to add on to what you've just said. Sorry to interrupt. Here we go.
Oh, no. And then my other tip would be for those people with fistula and graft. I mean, some people, because they are afraid of, after they remove the dressing, they're afraid of it getting wet, but you can actually wash it with water and salt. And if you see a scab, don't scratch it, please. And then for those people with the central venous catheter, we all know that it's very susceptible with infection. So we don't want it getting wet. So it's very difficult really to have a shower with it. But my practical tip would be really, if you see that it got wet, then make sure when you get back to your dialysis session, just tell the nurse that change your dressing, because it's better to change your dressing than a bacteria getting into your exit site. I keep telling my patient that I don't mind changing your dressing even every session if it needs to.
Definitely better to be safe than sorry. So yeah, making sure you stay on top of that dressing if you've got a line.
And then my other tip, it applies to fistula, graft, or with CVC line, that always check for signs of infection. If it is warm to touch, is it pain, or if it is aligned, if there's a green or yellow drainage, just report it straight away to the nurse so that we can do something about it. Because one thing is we always avoid infection or try to control it as quick as possible. Because there's some patient that they don't say anything, and then once it's really, that's the only time that they will say something. So any just a little hint that it could be sign of infection, like if you got a fever, what I just said earlier. So yeah, just tell everything to the nurse So, and then we'll do the rest. Another tip of mine, well, okay, it's actually this more like a reminder for patient with graft or fistula that we cannot use your arm with the fistula to take blood pressure. Make sure that it's always on the other arm. So some people, they tend to forget that taking blood pressure, they will have their arm with the one with the fistula. So with that, it's just a simple reminder because some people, they tend to forget.
And I think that's also a good reminder for people who have a line and they're preparing to get a fistula. The same applies not to use the arm that they're going to use for the fistula. And they do have bracelets that you can wear as a reminder from Kidney Care UK. So do check those out from the website. Can I add my own practical tips as well?
Yes.
As we're having this conversation, because as somebody that's recently started hemodialysis this year, I definitely have some tips that I would like to share. And the first one is bring a blanket, because you can get really, really cold while you're on hemodialysis. So I always have a blanket with me. And I also have a little mini suitcase on wheels. As strong as you may feel when you're going into hemodialysis, you might feel quite drained afterwards. So it definitely helps. Carrying your stuff might be quite difficult. So if it's in the suitcase, you can just wheel that thing along and you don't have to worry about carrying it. And then it also addresses your tip about carrying it on the arm.
Yes.
You don't have to carry it on the arm. Then your arms are completely free and there's no pressure on your arm. So it actually ties into one of your tips. So I'm happy about that. So,
wow, I mean, they're good tips. Those too. You know, I mean, when it comes with the blanket, most patients doing dialysis, their main complaints will be, oh, I feel cold. You know, can you turn on the heating? Because their blood comes out and then goes back in. So they're really prone to being cold. They can feel cold quite easily. So unfortunately, you know, in the clinics, we don't really provide blankets. So it's a good tip that you bring your own blanket. It's also to prevent infection. So basically, you better bring your own. Yeah, so that's a good one.
And another one that I've learned through doing as well is because my blood pressure can be on the lower side, I'm prone to get really bad cramps when I'm on the machine. So a tip that I have learned is there's a profile on the machine where the amount of fluid, you can actually adjust it over the time. So the way I have it, it goes up and down over the course of the treatment. And I have found that that has absolutely, almost completely taken away the severe cramps that I would get. So that's a hot tip. And some people might start their hemodialysis session where they don't take any fluid off for the first 30 minutes and then they kind of take the fluid off steadily for the rest of the session. But in my case, I'm alternating between higher and lower from the beginning, and it certainly has helped with the cramp. So that's my final hot practical tip.
Yeah, that's a good one because I remember few patients, because they've been dialyzing for so many years, they also know what's best for them. They will say, oh, nurse, do more now in the first 2 hours and do less on the last 2 hours. So it works for them. So like yours is up and down, up and down. So yeah, we have this profile that you can choose how to pull fluid out of the patient, how big or how small it is per hour, per minute, or half an hour. So yeah, that's really a good tip. That's a good call. Yeah. On my final tip will be, because, you know, in our clinic, we give teas to the patient. And then some patients, they bring their own food and bring their own drink. And my final tip is, if you will bring your own drink, make sure that it's not too much, not like 500 mils, or less is better. Because when we do the treatment, we set the amount of fluid that we will take. But if you're drinking more while you're on dialysis, after the dialysis session, and then you weigh yourself post-treatment, you will see that, oh, nothing has been reduced. I'm finishing as the same way as I came in. You know, so my tip is don't also drink too much fluid while you're having dialysis.
And I think that is a really, really, really important one to end on because, while you're sat there and if you are busy and getting on with something, you might not realize actually that you're drinking so much and like you said, defeating the whole object of having the excess fluid removed because you're just drinking it back on.
Yes.
Is there like a general, I know that we're not giving medical advice during this interview, but is there a standard amount of fluid that is recommended that's okay to drink while you're having dialysis?
Well, me, from what I have experienced, is maybe just like a glass will do, but more than that, I think it will be too much. Yeah, it's defeating the object. Yeah. Because we had several patients who they came in at X amount of weight and then they came out the same because they didn't realize that they were drinking too much.
Right. So would a practical tip be bring in a specific bottle with lines on so you know exactly how much, so you know not to drink more. So if you've got your bottle, then don't drink the cup of tea on top of that because that's also going to add. So make sure it's either your cup of tea or a measured amount that you're bringing in to drink.
Yes, that's correct. Yeah.
We've covered some great tips and advice today for hemodialysis patients, whether you're new to hemodialysis or have been on hemodialysis for some time. I hope there's loads in there that will help you. We've looked at being an active part of your care, fluid restrictions, following the diet by your dietitian, staying active, making the most of your time on dialysis. Don't let dialysis ruin your life. Wear loose clothing. Be mindful that you don't carry heavy bags on your fistula or graft arm, or lie on that side when you're sleeping at night. Using ice cubes as a way of helping with fluid restrictions. Keeping a weighing scale at home. Don't scratch your fistula scabs. Don't get your line wet. Always check for signs of infection on your line if you have a line. And don't outdrink your fluid restriction. And bearing in mind that if you drink whilst on the machine, still stick to your fluid restrictions. And also mine about the suitcase and profile on the machine and blanket. So yeah, lots and lots and lots of great tips there. So I'm asking a question that's a little bit different to what I would normally be ending with. So I have two final last questions. And the first is, what advice can you give to nurses who are aspiring to become a dialysis nurse someday?
My advice would be for those nurses who are aspiring to become a dialysis nurse someday, if you like a job that there's a routine, it's like more in general sense, dialysis nurse, we do things in a pattern. It's a routine that we put on patient, we take off patient. If you like that kind of job and also it's an outpatient, they just come and go. So I would suggest that you try become a dialysis nurse. And based on my own experience, you don't need a prior experience of applying to become a dialysis nurse. There's a training. You will be mentored and trained for 12 weeks. And I can remember that it was overwhelming me at first, but now I'm not afraid. And if you're not afraid of the blood, seeing blood's all your shift, then go for it. Yeah, because some people, even healthcare professionals, they cannot take too much blood mentally. It's too much to some people. And also, if you don't mind needling or cannulating patient, then go for it. That will be my advice. It's a very rewarding job. I can remember as well, because when patient eventually got transplanted, sometimes they leave us notes, thanking us for looking after them really well. It's very self-fulfilling. I mean, that's a kind of reward where nothing can amount to if you have been appreciated by your patient. So that's a very self-fulfilling one.
Oh, that's really, really lovely to hear. My final question is, what word of encouragement do you have for the listeners?
I would say, live your life. Don't limit yourself. I know there are already some restriction or limitations to what you can do, but as I said earlier, there's life around dialysis. I can understand some people maybe who are being recently diagnosed with kidney disease. First thing is really, there should be self-acceptance, but I know this is easier said than done, but it's a process, it's a journey. But once you get that self-acceptance of your current situation, then things will become more easier. And like my advice earlier, be an active part of the treatment plan. So because it will help you greatly if you know what's happening and what's about to happen, it will help you greatly with your journey. And like I said, there's life out there. Don't limit yourself. I mean, you can still have a normal life. Okay. With limitation though, that's the important bit. But there's help. If you're confused about something, you can always ask your nurse, any healthcare professional. We're here to answer your questions. There's no silly question really. Anything that you're in doubt with, ask. Just always ask. There's help out there. We're here for you.
That is a wonderful, wonderful word to end on. Thank you so, so much for joining me. Thank you for all the tips, advice, and encouragement that you've shared today. It's been an absolute pleasure interviewing you today. Thank you so, so much.
Dee, it's my honor to be here. While we were chatting off the record, I told you that I am one of your listeners. I didn't see it myself that I will be here today, but it's a pleasure and an honor to be interviewed by you and somewhat share some of my knowledge, some of my tips. I wish you all the best and all the success to come. And I hope this reach to any part of the world, because as I said, this is a very informative and very useful podcast for kidney patients and for also healthcare professionals. I even told you before, off the record, that while listening to your podcast, I'm learning new things. Thank you.
Thank you for listening to Diary of a Kidney Warrior podcast. And don't forget that you can contact me on social media using the handle Diary of a Kidney Warrior. Please do subscribe to the podcast and please do tell a friend. New episodes of this podcast are released every other Monday. Until next time, take care and choose to live.
Diary of a Kidney Warrior, sharing faith, knowledge, hope, and love.